Hello and welcome to Palm Beach Makeover. I'm Suzanne Stevens. If you're a follower of the makeover craze, you've probably looked in the mirror at some time or another and thought about changing some part of your own reflection. Well, tonight we'll meet some local people who have made some dramatic changes in their appearances and hear from local experts who have made their makeover dreams a reality. Welcome back to Palm Beach Makeover. I'm Suzanne Stevens. Breast augmentation, it's a big decision for some women. It means the figure they've always dreamed of. For others, it's an end to the baby era and the tolls that motherhood can take on a woman's body. Joining me now is Dr. Jeffrey Wisnicki, a certified board plastic surgeon. Thank you for joining us.
It's a pleasure to be here.
Now, what are some of the things that women say they grapple with before doing this procedure?
Well, by the time women come to my office to see me, they've thought about this for quite some time. And they're really there to find out more about the mechanics of the procedure because they've kind of made their decision. But I would say their primary concern is to look natural, and they want a natural outcome, not a surgical one.
So they don't want to look too big, don't want to look too small, but they would definitely want to see a difference.
I think that's key.
Okay, let's take a look. Let's meet two of women who have decided to use Dr. Wisnicki as their doctor.
I want to look good for my age. I want to look good for having two children. I want to be the one that they see in the mall, and you're saying, she had 2 kids? Look how good she looks.
Today, Laurel's self-confidence and energy shine through in every word she speaks. But that wasn't the case 2 years ago.
I would say I was very insecure. I didn't have a lot of confidence.
That's how Laurel described herself after having 2 children. She loved the changes motherhood brought to her life, but not the changes it brought to her body.
I like to say of it is it's shrinking. It's falling down to the earth. After teenage years, you're up. And right after you have the children, you're down. It seems like it all just gravity starts taking the effect, and you either can, accept it or you change it.
And Laurel decided for her, the right decision was to change it. So she made an appointment to see Dr. Jeffrey Wisnicki for a breast augmentation.
When somebody goes through motherhood, besides the obvious joys inherent in that, you also have the problems inherent in losing breast tissue as you're accustomed to having it.
Laurel's situation is one that brings many women into Dr. Wisnicki's office, but it's certainly not the only one.
I was pretty good at covering up what I look like. Like even my closest family after the surgery, I don't notice really a difference. And I was like, that's because I was really good at covering it up. But at the end of the day, when I go, home and it would all be over and you'd have to take them off, which is really what I was doing, I was miserable.
Katie had been considering breast augmentation since puberty, and when she entered her 20s, she decided the time was right. She researched the procedure, visited many specialists, and chose Dr. Wisnicki as her surgeon. So what was her initial response to her new figure?
It was relief. I was like, yeah, okay, now I can go on. Now this is what I'm supposed to look like. Everybody has, their little things that they hate about themselves, but to me it was just overwhelming. So it was relief.
Katie not only got a body she felt more comfortable in, she also found a new sense of empowerment.
To follow through with something finally, it changed the way that now I look at everything. Everything is a possibility. Everything is an opportunity for me to do something different.
The changes are not just the obvious ones, that is the physical changes. The changes extend beyond that in terms of how one feels in the world around them once these physical changes happen. And I think people often underestimate that.
It made me feel really good. I mean, my confidence is way, way better than I've ever been. I feel like I do more. I feel like I'm more outgoing. I feel that I'm more able to do things that I never did before.
But in the last year and a half, my shopping diva has come out. I need a new shirt. The ladies need a new shirt. They're getting tired of that cute halter top I bought 2 weeks ago. I'll never look back. I'm just thrilled. I'm just thrilled.
I don't want to see her credit card statement. Now it's time for you to join in our program. If you have any questions for Dr. Wisnicki, you can just call 561-514-7505. He joins us again to answer some of the most common questions about breast augmentation. Thanks for staying with us.
Thank you.
Now, first of all, what procedures would be considered for breast enhancement?
Well, breast enhancement obviously includes breast enlargement, but it may also include breast uplifting. And in some cases, you might even need to do a reduction with implants. So it's really all about contouring.
Now, how long does the surgery and subsequent recovery take usually? Does it differ in each person?
Well, sure, but surgery generally for breast augmentation takes about an hour and a half. Recovery typically is about a week, but it may be less in somebody who doesn't have a strenuous work activity. But it's in that range.
Okay, now how is breast size determined? Is it determined by the patient, by you, the doctor, who knows what looks best, or
well, I think
is it just up for grabs? I mean, how do you do it?
Well, I think it's in part all those things. We're looking at the patient's stature. We're looking at what the patient is looking for. Most women don't want their entrance into a room announced by their chest. But I would say, by and large, we look at all these variables, and together with the patient, we arrive at something most appropriate for them.
Now, can you still have mammograms? I think that's a big issue with women who have breast enhancement or had breast enhancement. Can you have mammograms with breast implants? And is it as easy, or is it more difficult?
You can. Special views are required. Most radiologists are fairly experienced doing mammograms in women with implants because so many women have them. But basically, we put the implants behind the muscle, most typically, and that helps the mammograms as well.
And I think a lot of women are concerned that breast implants cause cancer. Can you talk about that myth?
Surely, and that's exactly right. I mean, based on what we know today, that is a fallacy. Breast implants don't cause cancer.
Now, as you said, there are different procedures. What kind of scarring can we expect with each procedure?
Well, one nice thing about the saline implants that we use for breast augmentation is it allows us to keep the scars relatively small because we don't actually expand the implants until they're placed inside. So it does allow us to keep the scars to a minimum.
And really quickly, what is the downside of surgery?
Well, certainly you have to discuss the risks with your plastic surgeon, but I think the nicest downside might be the expense of a new wardrobe.
Yeah, I don't know. If you're married, that might be it. Well, thank you, Dr. Wisnicki, for being with us.
It's a pleasure.
Now our phone lines are open, so you can call with your questions for Dr. Wisnicki. Stay tuned. Palm Beach Makeover. We'll be right back.